patients that can refer with the suspicion of valvular heart disease, but they don't have symptoms. And this is difficult because the guidelines recommend to do an intervention when the patient has symptoms or where we see that there is damage of the left ventricular systolic function. But if there are no symptoms or there is no reduction of the left ventricular ejection fraction, then to decide on the timing is very much discussed and is very difficult. And that is where we need more advanced techniques to detect early damage of the ventricle or predict the progression or fast progression of that valvular heart disease and try to intervene earlier to avoid the consequences of valvular heart disease, to avoid the symptoms or to avoid the damage of the left ventricle. And that is where other measures come into play. For example, the determination of NT-proBNP in blood, or with techniques of strain imaging, use the measurement of global longitudinal strain, which has been shown in numerous publications that, for example, in patients with aortic stenosis or in patients with mitral valve regurgitation is associated with outcomes later on after intervention as well.